So the menopause, and what does it mean? So if you look at the slide here, it's got some pretty derogatory terms here. Because when people do think about the menopause, they do think of what it means to them, and words that are either said to them, they understand about it. And these are really negative terms. So again, this is why women feel that they can't discuss it. It makes them feel quite bad about themselves because the hormonal changes are happening. And when people are using terms like these, it just sort of like reinforces how they feel about themselves. So some of the words that are commonly used are she's going through the change, she's past it, or she's fat and attractive, she's old, dried up, or she's having one of her moments. I think the term age of despair is actually Arabic, and I think that's what the menopause actually sort of means. Past her sell-by date, oh, it's that time, weighty or moody. So none of these words are positive. None of them fill me with any hope or joy. They all make me feel unattractive and miserable and unhappy. And so this is why talking about menopause, even like flippant comments to somebody, oh, she's having one of her moments, it's understanding of that little comment and what it can actually mean to somebody that's having a menopausal issue at that particular time, because you're feeling low enough as it is through the menopause. And when these terms are used, it just reinforces the fact that you are past it and you are getting old. And it's all very negative, and it can have a real impact on your mental health. Thank you, Tammy. So menopause, what is it and why is it important? So this is a little bit of a recap from what we've talked about before. So just to say what the menopause is, it's the ending of the monthly period. So menopause is a Greek word, meno for monthly and pause meaning to stop or to halt. So it's the ending of your monthly periods, which obviously means the ending of fertility. And as our fertility is being reduced because we don't have any eggs left, or we've got very few eggs left in our ovaries aren't producing estrogen anymore, and so we become deficient in estrogen. And I think this is probably one of the most important things to remember, is that menopause is caused primarily by estrogen deficiency. And so the symptoms that we develop from menopause are due to lack of estrogen and other hormones as well. But estrogen is the main one. And that it affects everybody, and it affects all women. There isn't one woman that's ever going to avoid the menopause, because it's a natural transition that all women go through. Some women have very few symptoms of menopause, but some women have very significant symptoms. But it's not, for me, it's not so much about the symptoms, it's more to do with what's happening internally as well due to the estrogen deficiency. But we'll be talking about that at other times as well. And so what we can do to actually help with the estrogen deficiency is to replace the hormone that we're now deficient in. So if our ovaries aren't producing that estrogen anymore, let's replace it by hormone replacement therapy. And it's all about raising awareness of how the menopause is affecting our health and our ability to work. The more we talk about it, the more we realise that we might be struggling with issues at work. We might be having problems with having hot flushes. It might be a problem that our brains aren't working properly, or we just don't feel we can hack it anymore. We just feel that we've lost our confidence. And so by having a culture of understanding in the workplace, it makes people realise that they're not the only one, and that there is actually a reason behind this. Because many times women feel very, very lonely and very isolated during the menopause. And you don't realise how common it is to feel that way. But the more you talk about it and the more we raise the awareness of it, the more we can help improve things for women in the workplace. And it's about talking, and it's about removing the stigmas associated with it. Like I said, those terms that we used before, those negative terms, like I said, you hear these words, and women are sort of like men or people around you are just sort of like, thinking, oh, she's having one of her moments again. And it can have quite a negative impact on women. So the more we talk about it, the more we understand about menopause, and how it's impacting, the more we can do things to change that culture. And people with colour and LGBTQ plus groups, they do find it harder to talk about the menopause. And I found this in my experience of working in urgent care settings, that it isn't something that people generally talk about. It's something of the highly embarrassing, highly secretive, and it's just something that they are ashamed about. So the more we do talk about it, and particularly with certain groups of people, it's removing those stigmas and getting people to open up and talk to health professionals about their symptoms of menopause and not to suffer. Thank you, Tammy. It's frozen again. Oh, there we go. Thank you.
Okay, thanks.
The symptoms of menopause. So there are over 30 symptoms of menopause. So these are just some of them. So hot flushes and night sweats, they affect about 70-75% of women, which means there's about 25-30% of women that don't experience hot flushes and night sweats. So just because you're not having hot flushes and night sweats does not mean that you're not menopausal. There are many, many factors associated with menopause and estrogen deficiency, but hot flushes is probably the most common one. But if you're not having them, but you've got other symptoms as well, you really need to be thinking about menopause. Increased anxiety is something that I come across time and time again, that women are really having a hit with their loss of confidence and increased anxiety. So things that they would normally do, go into the shops, arranging trips out, ordering goods online, suddenly they feel very anxious and they just feel that they just can't do this anymore. They certainly can't. They have difficulties within the workplace. So again, these are really significant, have a huge impact on working and your personal life as well. Brain fog and poor concentration. Again, this is all to do with estrogen deficiency. So if your brain's not working and you can't concentrate, you can imagine how that's going to impact on your ability to do your job correctly. Mood swings. So it's a case that, you know, I do find that people they swing from one to the other. So sometimes, you know, within an hour, women can say that they're feeling really angry and they're feeling rage inside themselves. And then within a few minutes, they're crying at something that they've seen on the TV or read about. So it's up and down, and it's the mood swings. And again, you've got no control over your mood swings, and it's all to do with the estrogen deficiency. Well, that's certainly the biggest driving force there. Low mood in menopause is really common. Depression is a slightly different thing. Women often tell me that it's not depression that they're feeling. They just feel low. They don't feel themselves. They feel low in mood. They don't feel happy. They don't feel joyful. They just don't feel it. They don't feel anything. They feel hollow and empty, and you just feel flat all of the time. Lots of GPs are pushing for antidepressants at this point, but as we know, and as we'll be talking about as the months go on, it's about replacing the hormones that you're now deficient in, which is the way to go, and certainly the best course of treatment, particularly low mood related to menopause. Depression, obviously, if you've got a history of depression, particularly all through your life, you've been on and off maybe antidepressants, or you're still taking antidepressants, menopause will still be affecting you, and we do need to be thinking about addressing menopausal symptoms as well. But low mood in menopause is quite a different thing to having depression. Frequency in passing urine. So this is all part of the estrogen deficiency cells in the bladder and the urethra and the genitourinary system. And often women want to pass urine more frequently, so often get to go to the loo in the night, or having to go to the loo at work a lot more, and that can have a serious impact depending on what your job is. Aching joints and muscles, everything creaking and aching and stiff and tight, feeling like you're 90 instead of 45, etc. And again, it's just making sure that there aren't any other significant problems going on there. So maybe do discuss this with the GP. But for the majority of women, estrogen deficiency has an impact and causes our joints and our ligaments to become tight and stiff. And so again, that's a very common symptom of menopause. Headaches and migraines, fluctuations of the hormones are real triggers for headaches and migraines. So again, if you're working with people that are experiencing headaches on a more regular basis, again, it's a case of thinking, well, okay, well, what is going on? What's the cause of it? You know, and it is important to look at other factors, you know, blood pressure and vision and other things as well. But headaches are a very common menopausal symptom. So, and that might be something that people are complaining about quite a lot in the workplace. Itchy, dry skin. This is related to estrogen deficiency. So the lack of estrogen to the cells in the skin and in the genitourinary system as well. They can cause vaginal dryness, soreness, itch, and they can cause itchy skin. And there's a condition called formication, which is the sensation of insects crawling all over the body. And that's a common symptom of estrogen deficiency. So you're not going crazy when you feel that you've got things crawling all over you. The most likely cause is formication due to lack of estrogen due to the menopause. Thank you, Tammy. And this is just a little bit of a funny slide there. The 7 menopausal dwarfs. This slide's been bandied about for quite some years, but I still like it. It's just showing that we can be lots of different parts of those dwarfs there. We can experience all these different symptoms, from being angry and tired all the time, having hot flushes, memory fog, and being a bit crazy there as well. And we can literally swing from all these different ones within a few hours due to our hormone fluctuations, but primarily due to the decline in our hormones due to the menopause. Thank you. So this is just an area that I just wanted to touch upon because, you know, this is something that, you know, is there such thing as the male menopause? Is it real? And again, there's lots of conflicting information about this, but I just wanted to touch on the subject. The male menopause is referred to as andropause. But of course, the definition of menopause in women, the actual definition, is the ending of monthly periods and the ending of fertility. So obviously, this doesn't occur to men. So it's not the fact that men are experiencing that, but men can experience fluctuations in their testosterone levels. And so we do have to think that, is it a deficiency in our hormones that men are experiencing, or is it just the normal stresses of life that are impacting? Lots of conflicting views about it. So it was actually quite interesting reading about it. But with age, testosterone levels can become deficient. And some of the symptoms of testosterone deficiency in men is breast enlargement, loss of libido, erectile dysfunction, reduced muscle mass, reduced confidence. But of course, is stress and midlife contributing to all of these factors? And it most probably is. So it will have an impact upon it. But if you do think that you have some symptoms of lack of testosterone, then it is important to talk to the GP about it. They may do some bloods with you, but the other side is to look at what you can do to control some of the stress in your life and look at all the contributing factors as well. You know, life is pretty difficult at the moment, and particularly when you get to midlife, as we talk about with women as well, that we're juggling so many different things and we have so many more responsibilities than we did in our 20s. And so, you know, life is difficult, life is stressful. And so that could be a significantly, you know, contributing factor towards it as well. But you know, testosterone replacement is out there, and some private clinics do prescribe testosterone for men as well. But it's worth discussing it with your GP and looking at the bigger picture as well to see if you do think that testosterone deficiency is impacting either yourself or partners and things like that. Thank you. So how does the menopause affect you? So at home, how's the menopause impacted on partners? So really, it's if you're living with people, women that are going through the menopause, how is it impacting on them? Have you noticed any changes in their behaviour? Are they forgetting to do things? It's all about raising awareness and understanding of what women are experiencing, because the hormones just take over, and it's not being able to control how you feel, think, act at any one time. You just feel this cloud come over you, and you can't shift it. And it's a horrible, horrible feeling. And so if you know that you've noticed changes within the female members of your family, and then thinking all your friends, you think, well, you're not the same person that you were. Talk to them, ask them, is everything all right? What do you think the cause of this is? And certainly if they're in their 40s onwards, then menopause is something that we really do have to think about and do discuss with them. And again, with the things that were on the television yesterday, sessions like today, it's about talking and not about hiding behind, oh, it's something to be embarrassed about. It's about facing the problems and actually being open and honest with people that we live with and people that we're close to, because they might be desperate to talk about how they're feeling, because they might be really, really worried about their symptoms, particularly things like brain fog. Women talk to me all the time. Well, no, I'll rephrase that. Women don't talk to me about their brain fog. I pull the information out of them, because they fear that as soon as I say to them, or they admit that they can't remember things anymore, they immediately think I'm going to give them a diagnosis of Alzheimer's. But what I'm about to say to them is the fact that memory loss and brain fog is incredibly common during the menopause. So let's treat the most obvious symptoms first and give you the most obvious diagnosis first until proved otherwise. So that's what it's about, talking about the symptoms. So particularly your friends of the same age as yourself. And talk to your children that are with you as well. They might be really worried about you, thinking, what's happened to mom? What's happened to my older sister? Why is auntie behaving or acting in that particular way? She's really snappy and I don't know why. Or she's crying all the time. Or she just doesn't look herself. Or she's not the person and she's not doing the things that she normally would do with me. So do talk to the children in your family, and do try to make them understand a little bit of how you're feeling. Because it is important they know about it, because they're going to certainly need to know about it as they grow up later in life as well. And think about what support you can give within the family household as well. Is it a fact of doing some more jobs around the house to support partners or support family members or support your friends that are experiencing menopausal symptoms, that are struggling? Find out what you can do just to help them. It might be that some women that I know, they often have afternoon sleeps because they just feel exhausted. So, it's about picking their children up from school, or just making sure the house is a bit tidier for them, and having an understanding that, it can really impact on women. And it's not that we're putting it on, it's the fact that this is how it makes us feel, and we don't have control over this. So finding out how you can support people by talking to them and saying, how can I support you more at home? How can I support you more in the workplace? Even the little things can make a big difference. And in the workplace, how do you support menopausal women? Are there policies? Is there mandatory training? There are training days like we're putting on here now. It's all about raising awareness. So, finding out what support is there within the workplace. Again, it's to have that conversation. And maybe if there isn't enough in place, or you think things could improve, it's about talking about it and speaking to your managers to get something organised. And how approachable is your manager? And as a woman in the menopause, could you discuss your symptoms and how they're impacting on your quality of work? Because it's a well-known fact that menopausal women will give lots of different excuses for either not finishing their work or having time off sick, because they feel highly embarrassed that they don't disclose it's menopause. That's the reason that they can't complete the work, or they're having time off work. And a lot of that, again, it's related to the stigma associated with menopause. Oh, she can't hack it, she can't do it anymore. When it's a case of fact that you just need somebody to understand that you're struggling, and it's about seeking help and getting support within the workplace, that you might be able to work better. And by managers understanding more about the menopausal symptoms, they can help you get through this. Thank you. It hasn't moved, Tammy.
Oh, sorry. I think there's a little bit of a time delay coming across. Give it a few more seconds. If it doesn't come up, you've got it, Fab. Thanks.
Thank you. So getting the support right and understanding home life. So it's talking about how your partners will be exhausted. And as I've said, some women, well, in fact, I know lots of women that they just crash out either in the afternoon or they crash out come tea time. They're absolutely exhausted. And what they do say is the fact that if they can have a sleep in the afternoon in particular, they're catching up for their lost sleep, because menopausal symptom that's really common is insomnia, is altered sleep patterns. And so it's thinking, well, what can we do and how can we support our loved ones at home to create a better environment so they can feel better, they can sleep better. So if it means somebody having a little 40 winks in the afternoon, being aware that that's what they need to do to make up for some of the sleep. Insomnia is really common. So what can you do at home? Some women have different TOG duvets so that they have a cooler one and their partner has a normal one. The windows are left open a little bit if they're having a hot flush or a night sweat. You've got fans, or sometimes people swap sides of the bed so that women can be either near windows or near the toilet, because as we know that menopausal symptoms, particularly the night sweats, they can be really debilitating. So, you can either just feel a little bit warm or a little bit sweaty during the night, to full blown the fact that your clothes are wringing wet, your bed sheets need to be changed. So people can go from various aspects of that. And this is all because of the lack of estrogen. So it's thinking, how can we accommodate this? How can we deal with this in the home place? So it might be that separate bedrooms, or certainly thinking about changing places in the bed, or having like change of clothing close by so you're not disturbing partners. Because it's the fact that if you're up and down to the toilet or having to get in and out of showers or changing beds all the time, that this is going to disturb partners as well. So both of you are going to have a really bad night's sleep. And being aware that moods can change, so you can go from being really low to being really angry. And again, it's just having that awareness with your partner that they've got very little control over this, that that they're completely lost as well, and they don't know why they feel that they do. And it's that kind of helpless feeling because the hormones are controlling them, and they've got no control of how they're feeling at all. And relationships can be really strained during the menopause. So one thing I hear over and over again, and it's that women just don't know how to think, feel, act, because they don't know and they don't understand why they feel that they do. But from my point of view, it's a case of explaining to them that it's normal to feel like this during the menopause. It's not them, it's their hormones, because they feel lonely, they feel isolated, and they just want to hide away. And so it's thinking yourself that if somebody that you're living with has sort of like cut themselves off from their friends a bit, they want to be alone, or they're feeling really quite anxious and they want to be with you more because of their increased anxiety, it's making them aware that you understand, and that you do care about them, and that you're taking your time to understand more about how the menopause is affecting them. And so it's a case of working together and not pulling apart, which can be very difficult, but it is a case of trying to pull together instead of pulling away. Thank you, Tammy. We're stuck.
Okay. If it doesn't come through, I'll do the trick I did before and unshare the screen, but I'm hoping it comes through anytime now.
Yeah, it's done.
Fab.
On a go slow. There we go. So this is about getting the right support with our working life. So it's about people that we're working with understanding that poor sleep patterns due to the menopause means that women will be feeling exhausted through the day. So they are going to be stressed. They are going to feel anxious. They're not going to be able to cope as well, because as we know, sleep deprivation is a form of torture. And not having a good night's sleep is the one thing that women are always saying to me that they wish that they could sort out more than anything, because if you have a good night's sleep, you feel that you can face the world. So it's really going to impact on your ability to communicate. You can't smile so readily to people, you might look ill, you might not be eating properly because you're just absolutely exhausted. And so it's really having awareness of how menopause is going to affect you in the workplace, particularly if you're looking half asleep. It just can't be helped. But, it's a case of putting measures in place and thinking, what can we do to help support people with this? And the brain fog, you're not only exhausted because you're not sleeping, but the lack of estrogen to your brain is making you forget things all the time and making errors. It causes you distress, it increases your anxiety, and really knocks your confidence as well. So again, it's thinking that all the mistakes that you could potentially be making or have made. I think it's just thinking, what can I do? If you know that your brain isn't working properly, what can I do here? What measures can I put in place so that I can deal with this? And again, it's about talking to your manager about it and talking to Occy Health and your GP. So depending on your job roles, it can be really problematic. And if you are late for work a lot, if you are making some serious errors within your work, then your employer will be possibly putting them on performance reviews or starting disciplinary action. And there's just one thing here. I mean, in a few months' time, I'm talking about menopause in the workplace, and I'll be discussing it in a lot more detail then. But there have been some interesting cases where women have been dismissed due to their menopausal symptoms, even though they have discussed it with their GP, and they've actually taken their employer to court and won because of it. So it's a case of remembering that workplaces have a responsibility to support menopausal women. And it's a case of looking through your policy and seeing to make sure that it is working for you, and also to speak to unions as well. But, if we are struggling with our menopausal symptoms, we do need to make people aware in the workplace. And women are often telling me that they want to reduce their hours. They're going part-time because they just don't feel that they can do it anymore. The confidence has been notched, their anxiety's increased, they're forgetting everything. It's a recipe for wanting somebody to stop work because they can't hack it anymore. But again, this is all to do with estrogen deficiency. This is hormone deficiency that's driving these symptoms. And again, thinking about how your working environment can be altered to improve some of certainly the physical symptoms as well. I mean, if you've got, I know in hospitals, you've got fixed temperature controls, or in nursing homes and things like this, that, you've got, a boiling hot wards or boiling hot rooms or hot offices, windows that don't open very far. And women can really be suffering with menopausal symptoms because of things like this. So it's just thinking, well, how can we adapt things in the workplace to support women that are having hot flushes? So again, it's just thinking out the box a little bit. Uniforms, before COVID, as a nurse working on a ward with an apron and gloves on, potentially for quite some time in a hot, stuffy ward, doing lots of physical work, you'd be really hot and really uncomfortable. But if you throw having a menopause hot flush in the mix and wearing PPE as well, I mean, it's just, I could cry when I think about it. It must be absolutely awful. And then obviously we're wearing PPE, but some uniforms that some people are wearing, police officers, the fire service as well. Can you imagine what it'd be like in that emergency situation with heavy uniforms on, and you're having a hot flush as well? So again, it really is looking outside of the box and thinking, how can we manage these symptoms? And the other thing as well that's really common, I touched on it briefly before, but people often need more toilet breaks because of the lack of estrogen to the genitourinary system. So the lack of estrogen to the bladder cells, the vagina, the urethra, etc., and the pelvic floor mean that you have urgency, that you need to pass urine far more frequently, and you can have bladder leaks as well. And also during the menopause, you can have problems with irregular and heavy periods as well. And I remember speaking to one place of work a little while ago, massive big office, and that there was like, I think it was like one shower room or one larger toilet, which was like on 2 floors down the other end of the building. People were telling me about when they were having really heavy periods, it would just start because of the menopausal symptoms, and they'd be so embarrassed. They'd have to walk past all these people because they were having, excessive menstrual bleeding. And it's a case of just having an awareness, thinking, well, how can we manage this? So the more we talk about how the menopause and women's health is impacting on our quality of life and our ability to do our job, the more we can start to think, okay, well, maybe we need to just make a few changes. But women are often reducing their fluids. They're not drinking enough because of fear of they can't go to the toilet because of their job that they do. I mean, call centres in particular, they're limited to the amount of toilet breaks that they can have. And, if you've got menopausal symptoms, you've got bladder weakness, you've got bladder frequency, you're having irregular heavy bleeding, this can really impact on the way that you can work. So it's just thinking outside the box with all of this, and you can see how it would impact on things. So how can we help? So it's about understanding the menopause, which is what we've talked about today. So the more understanding we have, the better we can support colleagues and people that we live with and friends that are experiencing menopausal symptoms. Looking around the workplace and ensuring that we've got menopause policies, that we've maybe got support on the intranet. And it's all about thinking about how culturally different groups of workplaces and people deal with the menopause, and thinking, okay, well, maybe we need to support certain groups of people more than others, and talking about how we can support each other. So talking to colleagues and friends and family, and working on how you can improve relationships at work and at home as well by being more open about it. And it's about working together, and relationships at home and at work will improve if we start to remove the stigmas and just start to talk it a bit more freely. It's an estrogen deficiency that's driving this. It's a hormone deficiency. It's a normal transition in life, but it doesn't mean to say that it's an easy process or we have to ignore it or be embarrassed about it. We just need to deal with it head on and then find out what we can do to improve our symptoms. And it's about getting support and working together. And it's thinking about how we can do things ourselves. Exercise is brilliant. It's a case of losing weight will help with our menopausal symptoms. But exercise and hobbies, and either doing things together or even doing things all by ourselves, it all has an impact on our mental health. And if we have less stress and less anxiety about certain things and we feel happier, we will deal with our hormonal problems a lot better. Thank you, Tammy. So what will help, as we've said, is about talking to friends, talking to colleagues and getting support from people around you. And once you start to open up, particularly to colleagues or to your best friends, you might realise that actually they're struggling just as much, but they didn't want to talk about it either. So having the courage to talk openly about how you've been feeling might be the catalyst that they need to go and do something. So this really is about talking to your doctor or health professionals about menopause. And discussing hormone replacement therapy with them and seeing if this is something that will be open for you. It's about signposting. So what we can do in the workplace about signposting via the intranet to HR, Occi Health, or different support groups and the wellbeing teams within the workplace. Things like mindfulness and pampering. We all need to feel loved and appreciated and feel special. And by pampering ourselves as women, I know it's been difficult through lockdown, but we do find that really helps our mental well-being, and it makes us feel the person that we used to be. So, pampering it does really help us. Exercise helps produce lots and lots of lovely feel-good hormones, which again just help our mental health and help us lose weight as well. And having time to ourselves. So, thinking about your partners looking stressed or harassed, give them time out, ask them what they want to do. And it's a case of, giving them running a hot bath for them, giving them some time out and working together. So time out as a couple, away from children, away from families, And just pulling together as a couple can really help. And again, that can help in the workplace as well. It's about working as a team, and pulling on our strengths and supporting each other when we really need it. And it's about changing the cultures amongst ourselves, amongst our families, to remove the stigmas associated with menopause. Thank you. And talking therapy is something I can't even begin to say. It's really, really important. When we talk to like-minded women in particular that understand what we're going through, understand our feelings, and just get us and get it, it changes our hormone levels. It increases our oxytocin, which is the love hormone, which is the bonding hormone that we produce. That's why we feel calmer and we feel happier after talking to like-minded women about our issues. It's like, we like to have a bit of a rant and a moan, but the reason we like to have a bit of a rant and a moan, even if it's for like 20 seconds, is because it increases our oxytocin and decreases our cortisol, which makes us feel better and we can cope. Thank you. So a recap then. So we've talked today about what the menopause is, and we've talked a little bit about the male menopause. We've talked about some of the emotional symptoms that women experience during the menopause, and how relationships at home and at work can be strained because of the menopause. And having an awareness of this, it's about working together and not pulling apart. So managers in the workplace can understand how they need to support their staff, their female staff. And it's all about appreciating each other and just working together, but getting the professional advice about your menopause and your menopausal symptoms is absolutely essential as well. So talking to GP or talking to health professionals who specialise in menopause, or the wellbeing teams at work, etc., where you can get support for menopause. Thank you. Stopped again. Oh, there we go. Okay, so on what we're doing here, so this is just a recap really what we're doing. So we're running twice monthly presentations on different menopausal topics. So obviously today we've been talking about the menopause when it's not directly affecting you, but affecting people that you work with or live with. And we're running different sessions, different topics every month. And so this is running now until November. And it's all about generating discussions, removing the stigma, removing all the issues associated with menopause, so that we can support each other at home and in the workplace. So shortly, well, in a moment, we're going to be having question and answer sessions, and then we'll be going into the Menopause Cafe and the breakout rooms, which Tammy and Sam will sort for us. If you've got issues that you need to talk about, concerns that you have about menopause in the workplace, do talk to your line manager, HR, the wellbeing teams, and occupational health, as well as your GP. And there are some websites there. So there's the Hub, the Black Country Healthcare NHS Foundation Trust. You'll find information there. That's my website, borntocare.co.uk. I've got lots of information about menopause and about me and what I do to support women. A really good website is the women'shealthconcern.org. Really good, informative website. And then there's the British Menopause Society website beneath, and then obviously the NHS one as well. So some really good information on these sites about menopause and support.